how to apply the Tinetti performance-oriented mobility assessment, or the POMA. You need a chair, an armless chair, and you need a path. This is a 15 feet or 4.5 meters path. And usually it takes from 10 to 15 minutes to complete this assessment. And there are two sections, the balance assessment and the gait assessment. We will start with the first one, which is the balance assessment. So the performer is sitting on the chair, and the scoring system will be an ordinal scale. You have 0, 1, or 2, the scores. 0 the most permanent, and 2 the most independent. Okay? So it's very important to explain to the performer what to do, and the physiotherapist needs to observe the response and then score upon this observation. So we will start with the balance assessment, starting from sitting. And for the sitting, you have to assess whether the sitting posture is steady or not. So if it is steady, here it's steady for Ahmed, so he will score 1. Then you will move to another category, which is to rise up. Now, in the rising up, we have different things to observe. So before we ask him to rise up, I will just in a hurry explain what to expect from the physiotherapist who is observing this process. You need to assess the how was the rise up. Did he use his arms or not? You also need to consider how many times it will take him to rise up, so the number of attempts. And also you need to observe the immediate standing balance, so the first 5 seconds, whether he was able to stand steady or not. And then for the standing balance after the 5 seconds in general, so was it a narrow base of support and steady standing. So all these 4 things you need to consider and you need to think about while you're asking the performer to rise up. Okay? So now Ahmed, please, could you rise up to stand up? Okay. And as you can see, all the things that we have talked about earlier about the rising, the attempt, the immediate standing balance, and the standing balance, we will score like 1, 2, 2, 2, and 2, because he was steady in all these things, and we will explain later about this. And then you have nudges. So from the sternum, on the palm of my hand, I will apply nudging, and as you can see, he is standing. We call this the maximum position, because we will ask him to narrow the base of support as, could you please narrow both, yes, as it, yes, the maximum that you can. And then I will apply nudges and observe the response of Ahmed. So 1, 2, 3. If he is steady, he will again score 2, and then 2. And then with this position, again, this is called the maximum position because he's standing in the narrow space that you can. Please close your eyes. And again, you need to observe whether the standing is steady or not. So again, he will score 1. Okay, you can open now. And then, just this. Now we will ask him to turn 360 degrees. So you will turn and go back to this. Thank you. And again, you need to observe whether the you have to observe actually 2 things: the continuity of the steps. So was it continuous steps when he applied this movement, and whether he was steady or not. And actually it was continuous, he was steady, so again he will score 1 and 1 and 1. And then lastly, we will ask him to sit down. So yes, and again you need to observe how was the process of sitting down. Was it safe and smooth, without help, without using any arms, and here he will score 2. Maybe you have noticed that sometimes he scored 2 or 1. It depends on the category, because sometimes the maximum score is 1 and sometimes the maximum score is 2. That's why sometimes he scored 1 or 2. This was the first section, which is the balance assessment, and the total balance score, which the maximum is 16, and for this case he scored the maximum, so he scored 16 out of 16. And then we will now move to the other section, which is the Gait assessment. Okay? So, in the Gait assessment, as you can see, we have, again, he's sitting on the chair, and we have this path, which is 15 feet, or 4.5 meters. And again, we will ask him to stand up, and again, he will now walk down this path, and in every, while he's walking, we need to observe certain things. So before I ask him to walk, you need to pay attention to the initiation of gait, because we will be scoring something about this. And then we need to observe the step length and step height. Okay? This is another thing, step symmetry. So you need to compare the right with the left, and the step continuity as well. And also, you need to be looking for all the body. So remember to observe the trunk, because we will be scoring something about this way of the trunk. And that's in general about the gait assessment. We will start now. So you can, please, could you walk this path? Then go back again. Thank you. You can sit now. Now, if you want to break what we have done so far, so for the initiation of gait, you have noticed that when I said go, he actually started walking with no hesitation, and that's why he will score 1 for the initiation. And then for the step length and the step height, I was observing the way he walks. So we have like scores for the right foot and the scores for the left foot, because sometimes maybe we can find some differences. So you need to decide whether when he was walking, the right foot actually passed the left foot or didn't pass. So that's why actually his right foot passed the left foot, so he will score 1. And the other thing, you will decide whether the right foot actually cleared the ground or shuffled. So if he was able to clear, and this reflects the height, again he will score 1. And the same will be done for the other foot, the left one. And then, while he was walking, we also observed the step symmetry. So what the step length for the right was similar for the step length for the left, and it was symmetrical. So again, he scored 1. And the step continuity. So as you can see, when Ahmed was walking, actually his steps were continuous. So the step continuity, he scored 1. And then for the, while he was walking the path, we have here a tile, 12-inch diameter, 30 centimeters, and he was able to walk straight down that path without any marked deviation. So we were also observing whether there was any deviation while walking. And also I said something about the trunk, and actually it was steady, there was no sway, and no use of arms or any assistive device, and that's why he scored 2 in this category. And then finally, the walking distance. So while Ahmed was walking, his base of support was relatively narrow, and his heels were almost touching. He didn't use wide base of support, and that's why he also, for the walking distance, which is the last category, he scored 1. Now, the section for the gait assessment, we have a total mark of, or a total score of 12, and he scored 12. So now we need to add 16 plus 12, and then you have certain or 3 categories that you can apply for your performers or for your clients. And because he scored the maximum score in this test, he has a very low fall risk.